Hi everyone, my name is Gabriel. I have Jeanette here. We will be evaluating Chris on a PARQ, which is a physical activity readiness questionnaire. Questionnaire really tells you if it is necessary for the client to seek further advice from a health professional before exercising.
Okay. So, has your doctor ever said that you had a heart condition or high blood pressure?
No.
And do you ever feel pain in your chest at rest or during your daily activities of living or whenever you do physical activity?
No.
Okay. Do you lose balance because of dizziness or have you ever lost consciousness in the last 12 months?
No.
Okay. Have you ever been diagnosed with another chronic medical condition other than heart disease or high blood pressure?
No.
Are you currently taking prescribed medications for a chronic medical condition?
No.
Okay. Do you currently have or have had within the past 12 months any bone, joint, or soft tissue problems that could be made worse by becoming more physically active?
No.
Okay. And has your doctor ever said that you should only do medically supervised physical activity?
No.
Okay, perfect. We can move on to testing. So before we take resting heart rate and blood pressure, we must make sure that the client rests their arm for at least 5 minutes, and we want the arm to be non-dominant, fully extended and relaxed, and the palm in supine position. And we want to make sure that it's also resting at heart level.
Alright, while Chris is resting, we will measure the bicep as the belly to ensure that we use the appropriate cuff size when using a sphygmomanometer.
So we have 35 centimeters, and the limitation is about 40. So this is the right size.
Jeanette will now take the resting heart rate. She will count how many beats she feels from the radial artery for 30 seconds. First, you have to feel for the radial artery.
Alright, so I have about 35 beats per 30 seconds, so that means there's about 70 beats per minute.
Next, we will take Chris's blood pressure. Sliding the cuff up the arm, Jeanette will make sure the tubes are aligned with where the brachial artery splits into the radial and ulnar artery, and then there should be about an inch of space between the antecubital and the bottom of the cuff. Alright, so putting on the stethoscope, you should have to make sure the earpiece is pointing forward. And then first Jeanette will pump the cuff up to 200 millimeters mercury and slowly decrease by 2 to 3 millimeters mercury per second. During this time, she will be listening for when the radial pulse appears. This should be the systolic pressure, and then when it disappears, it will be the diastolic pressure.
So it's 130. Over 80.
We will now be taking blood pressure during exercise. During this time, we have instructed the participant to refrain from grabbing the handlebars during testing.
Taking the same precautions and using the same placement, the cuff has been pre-positioned before starting exercise. The lower edge is placed about an inch above the antecubital fossa and the midline and tubing over the brachial artery.
When acquiring blood pressure measurement, we will need to limit arm movement. During this time, you would stabilize and support the participant's arm between your trunk and arm. Also, make sure that the manometer pressure gauge is at eye level, ensuring a clear view of the pressures.
Quickly inflate the cuff well above the anticipated value, which you obtain during rest.
Taking the stethoscope diaphragm, place it over the brachial pulse slightly under the cuff superior and medially to the antecubital fossa. making sure the entire stethoscope is contacting the skin.
Again, slowly releasing pressure by 2 to 3 milligrams of mercury per second. During this time, you would listen for and note the very first loud, sharp tapping sound. This is the first quarter cough sound corresponding to systolic blood pressure. Continue reducing the pressure slowly at the same rate of 2 to 3 milligrams of mercury per second. Note when the sound disappears.
During this testing, we also recorded the heart rate during exercise. Again, using the index and middle fingers and palpating for the pulse at the radial artery, we counted for 30 seconds and doubled for beats per minute. Alright, 40, so that's going to be 80 beats per minute.